Come in.
Hi, Ms. Toots.
Hi.
My name is Raven. I'll be your nurse for today.
Hi, Raven.
During my hand hygiene, providing privacy for my patient, could you please state your name and date of birth for me?
Sonia Toots, November 3rd, 1975.
Can I check your wristband and make sure? Perfect, great. Alright, Ms. Toots, so the doctor has ordered for some assessments for you. We're going to get your cardio, your respiratory, your musculoskeletal, and neurological assessment done, okay? Alright, so first I just want to go over some safety tips here at the hospital.
Okay.
Alright, so you want to make sure that you're always wearing non-skid socks and shoes just when you're getting up and moving, you're not slipping or falling or anything. And we want to make sure that you have your bed rails up. You can have 2 or 4, whichever is good with you.
Okay.
And we want to make sure that your bed is locked so that when you're moving in and out of bed, it's not moving with you, okay? Also, you want to make sure your bed is in its lowest position so when you get it in and out, it's not hard for you. Right, and then we have your wristband, Ms. Toots, that I just checked with you, and that's a way to identify you. So when we have to pass meds to you or get your vital signs, we're scanning to make sure that you're Ms. Toots.
Okay.
Alright, and then we have your call light button. You'll press this anytime that you need us, and I can come or any of my other staff members could come.
Okay.
Alright, Ms. Toots, we got all that covered. Any questions with your safety?
No.
Alright, wonderful. Okay, so we're going to start off with your cardio assessment. We're going to sit your bed back in semi-Fowler's position, which is 45-degree angles, and we're just going to take a look at your jugular veins. So we're just looking for any distension, okay?
Okay.
Can you turn your head this way? Right. And then turn this way. Wonderful. Don't see any distension in your jugular veins. Great. And so now, Ms. Toots, I'm going to check for your palpating of your pulses. So we're just going to check that your radial pulses. Can you turn it inside? I'm just checking bilateral, meaning that I'm making sure your pulse, I feel your pulse in both arms, okay?
Okay.
It's okay. That's it. Okay, great. Your pulse is pulsing at 2+, which is normal. And then I'm going to check your dorsal pedis, which is in your feet. Alright. That pulse is also a 2+, which is normal. And I'm going to check your posterior tibial, which is like in your inner ankle.
Okay.
And that's also 2+, normal, Ms. Toots. Great. And I just want to also check out other pulses in your body, which would be your popliteal, which is behind your knee.
Okay.
Your femoral, which is in your groin area. Your brachial, which is in your arm area. Your axillary, which is under your armpits. And then your carotid, one is on each side of your neck. Okay. Alright, Ms. Toots, so now we're just going to check for capillary refill. So we're just going to test the refill of blood refilling your fingers.
Okay.
It should refill in 2 to 3 seconds. Can I see your fingers? Great. Alright, wonderful, Ms. Toots, your refill time is great. Alright, so now we're just going to check for edema. So I'm just going to feel on your arms to feel for any swelling, okay? I'm just going to go from proximal to distal. And shake your feet. Alright, wonderful, Ms. Toots. I didn't feel any swelling, okay? Alright, so now we're just going to take escalating of your heart sounds.
Okay.
So I'm just going to check each valve of your heart, and I'm going to use my stethoscope. And this is the diaphragm part of my stethoscope. I'm going to check this first, and then I'm going to turn it into the bell side, which checks for murmurs. Okay. So, alright, verbalizing my stethoscope is in contact with my patient's skin. This is your aortic, your pulmonic, herbs. Can you lift your left breast up for me? Thank you. Your tricuspid, and your mitral. Alright, and now we're just going to change it to that bell side, like I said, to listen for murmurs.
Okay.
Alright, your aortic, your pulmonic, your herbs. Can you also lift that breast again for me? Thank you. Your tricuspid, and your mitral valve. And also, Ms. Tooth, have you been having any chest pain or shortness of breath?
No.
You haven't? Okay, wonderful. All right, Ms. Tooth, that's the end of the cardio assessment. We're gonna move over to your respiratory assessment, okay? All right, Ms. Tooth, so with your respiratory assessment, I'm just going to check your respiratory rate. Just gonna check your breathing.
Okay.
Is it okay if I put my hand on your shoulder? Alright, great job, Ms. Tooth. Your breathing is at 16 respiration rate. And now I'm gonna listen to your, ask you like your breath sounds.
Okay.
Alright, I want you to take a deep breath for me. That's your right upper lobe. Another deep breath. Left upper lobe. Your left lower lobe. Your right lower lobe. Alright, Ms. Tooth, could you cross your arms for, you can do one at a time. I
Okay.
just want to check your lateral side for your breath sound.
Okay.
Okay, deep breaths for me. Good job. I'm gonna check this side. Again, deep breaths. Wonderful. Okay, so I just check your interior side. I'm gonna check your posterior,
Okay.
which is your back. I just want you to lean forward for me a little. Great. Alright, so take deep breaths. Your left upper lobe. Great. Your right upper lobe. Alright, your right lower lobe. Your left lower lobe. Alright, great job. Your breath sound clear to me, Ms. Tooth.
Okay.
Thank you. Alright, so now we're just going to go over some exercises to help with basically loosening your mucus in your lungs if you're, so where to prevent like pneumonia. for
Okay.
instance. So one of the exercises is called cough and deep turn. So you're going to turn to your side, you'll take a deep breath in, and you'll cough. And you can do it to the other side. And you'll do this every 2 hours, Ms. Tooth. So you can do the right side, and then after 2 hours, you can do the left side.
Okay.
Another exercise to also help with loosening your lungs is using your sedative spirometer. So with this, you would take a deep breath in, hold for 2 to 5 seconds, and let it out. All right, so this right here, you can do every 10 times an hour.
Okay.
And basically, like during commercial break would be a good time to do it.
Okay.
Could you just, can you show me an example of it? Describe. Yes, thank you. Wonderful, Ms. Tooth. Okay, thank you. All right, Ms. Tooth, are you having any pain today?
No.
All right, thank you. Okay, so now we're just gonna move on to the musculoskeletal assessment.
Okay.
All right, so I'm just going to show you. Can I use your arm for example?
Okay.
Okay, so what I'm going to show you here, Ms. Tooth, is when your arm is straight like this, we call this extension.
Okay.
And then if you were to turn your arm in and flex, like you're flexing your muscles, perfect. This is what we call flexing.
Okay.
And then we also want to, if you was to move your arm all the way back, this would be called hyperextension.
Okay.
So this is just the mobility range of your arm.
Mhm.
You can do the same thing with your leg as well, okay?
Okay.
And even your neck.
Okay.
All right. So now I just want to test your strength of your joints.
Okay.
So I want you to turn your perfect, your arm, your wrist in. I want you to push against me. Great. And then I want you to turn it inside. Yes, great. Good job, Ms. Tooth. And now I'm just going to test your shoulder joint.
Okay.
So I want you to push down against my hand. Great. And then I want you to push up against my hand. Wonderful. Your strength is great, Ms. Tooth. Okay. All right, Ms. Tooth. So now we're going to move over to the neurological assessment.
Okay.
Okay, first thing I want to look at is, ask you, about is, have you had any head injuries?
No.
All right. So now Ms. Tooth, we're looking at your head first, and so I just want to look at to make sure that your face is symmetrical and your eyes are symmetrical, which everything is, okay?
Okay.
All right, so now we're going to move over to the ear, which is, do you have any problems hearing?
No.
No? Okay, so we're going to perform what we call the whisper test. I'm going to stand arms length away from you, and I'm going to whisper a number and letter combination, and I want you to repeat it back to me, okay? 5,
5ST.
Wonderful, good job, Ms. Alright, so now we'll move over to the eyes. Do you have problems, do you wear any glasses or contacts?
No.
Alright, so I'm just gonna check your pupillary for your light response. I'm gonna do a direct, a consensual, and accommodation, okay? Alright, so what I'm looking for here is just the constriction of your eyes, or both of your eyes when you just shine the light on one side, okay? Okay, great, let's see. So now I'm just gonna shine the light in one eye, and I wanna make sure that this eye responds at the same time with this one, okay? Alright, great, Ms. Toots. And then now I just want you to follow my pen light as I move it closer to you. Alright, great, Ms. Toots. Your direct and consensual is spot on, okay? And I'm just gonna just rate your pupil size, okay? I would say that your pupil size is about 3 to 4 millimeters, okay? Alright, so now we're going to move over to nose, which, do you have any frequent nasal congestion or runny nose?
No.
No? Alright, so we're going to do the nostril patency test, which I would want you to hold one side of your nostril, sniff in, and then do the same to the other side. Wonderful. Great, good job, thank you. Alright, so now let's do, are you having difficulty swallowing?
No.
Could you swallow for me? Good job. Alright, so I'm just going to take my pen light and I'm just going to look on the inside of your mouth and just checking for pink, moist, no decay, okay? Alright, everything looks good. Everything is pink, moist, and no decay. Alright, and have you had any headaches recently?
No.
Great. Okay, could you state your name for me and your date of birth again?
Sonia Toots, November 3rd, 1975.
Okay, do you know where you are, Miss Toots?
Yes, at the hospital.
At the hospital. And do you know what year it is?
2024.
Alright, and one more last question. Who's the president for today?
Joe Biden.
Thank you. Alright, this is just a level of consciousness. I'm just asking to make sure that you're conscious and you're in time frame of where everything is going on, okay? And then I want to explain to you the Glasgow Coma Scale.
Okay.
This test is a neurological assessment that measures a person's level of consciousness after a brain injury. Okay, and the things that we look for in this test is eye, motor, and verbal responses. Okay. Alright, Ms. Toots, do you have any questions?
No, no questions.
Alright, you did wonderful, Ms. Toots. I'll get this, your assessments documented and went over to your doctor. You have a great day and thank you.
Thank you.
You're welcome. Alright, providing privacy for my patient and doing my hand hygiene.